Performing arts, we've been told that we won't be able to go back on stage until there's a vaccine.
We're trying to, get answers to questions that performers really want to know. Can I do my art safely? We are trying to understand what the size and composition of aerosols that are released from the respiratory tract when people are singing, playing instruments, and talking. So essentially thinking about what are the types of aerosols that come out from either their mouth or from the bell of the instrument. The goal is to understand that because when we think about viruses that are spread through respiratory droplets or smaller respiratory particles, understanding the size and shape of those particles tells us something about their likelihood to carry the virus and transmit that virus to others.
We can't wait. We've already been 5 months without our jobs, without our livelihoods. I want this study to really open up eyes about how we can move forward.
We're testing them doing it with and without wearing a mask, and we're looking to integrate into our study things like bell covers on the instruments and other types of technologies that might help reduce that. So I think one of the most interesting and important findings we hope to have from this is not just what are the emissions that come from playing instruments or from singing, but what can we do about that? Which would in turn mean something that we can do to lower that risk of transmission and think about how we can safely do performing arts activities in the world of COVID. Our study is being performed in an aerosol chamber that here at CSU it's referred to as the Simulated Environmental Testing Facility, or the SET, which works really nicely for this performing arts study. We essentially isolate the air within that room from the outside air. And then we run some instruments inside there that are measuring the particle sizes and distributions and counts.
We aren't scientists, we're musicians. So we need that scientific input to know how to move forward in this field. We can't let this virus stop us.